Hi, I'm Bailee Bland, and I am the School Nurse Coordinator for Carthage R-9. Today, I'm going to go over some medical equipment and basic information that may be required to use during a medical emergency. Here we have our automated external defibrillator, also known as the AED. This will be used to help those experiencing a sudden cardiac arrest. Most AEDs are in a mounted case on the wall near your building's office. The nurse of your building will go over the location with you. First, you will make sure you press the on button in the top corner. You will lift the top portion of the AED and apply the pads to the patient's bare chest. The machine will walk you through the following steps depending on the patient's status. Next, we will go over some medications that may be administered in an emergency. This is an EpiPen. This medication is used to treat serious allergic reaction to insect stings, bites, foods, drugs, or other substances. This epinephrine is a fast-acting medication that improves breathing, stimulates the heart, increases blood pressure, while reducing hives or swelling of the face, lips, tongue, or throat. To use this medication, you will pull the blue cap off of the top and firmly push the orange on the outer thigh until you hear the click. Hold for 10 seconds to stimulate this delivery of the drug. Next, we have our albuterol inhaler. This medication is used to treat or prevent narrowing of the airway in the lungs. The patient will open the end of the mouthpiece and press it into their mouth and close their lips around the mouthpiece. Instruct the patient to fully exhale and then breathe in slowly and deeply. At the same time, press down on the container to spray the medication into their mouth. Encourage the patient to hold their breath for 10 seconds if possible for the medication to absorb. This is Narcan nasal spray. This medication is used for the treatment of a suspected opioid overdose emergency. In a case like this, you would see breathing problems and severe sleepiness, or the patient unable to respond. To administer, hold the Narcan with your thumb on the bottom of the plunger and your first or middle finger on either side of the nozzle. Tilt the patient's head back and insert the nozzle into either nostril and administer one full spray to one nostril. In most cases, your building nurse will be the one administering these medications in a medical emergency. If you have additional questions or concerns, you can reach out to one of them or myself. Now we will go over some first aid protocols for seizures. In the event of a seizure, it is important to stay calm and understand you cannot prevent it from happening. Moving any nearby objects out of the way to prevent further injury to the patient is crucial. Pay attention to the length of the seizure, and if possible, turn the patient on their side. Your building nurse will collaborate with qualified staff to develop a C team for this year. These will be staff members who are CPR and first aid certified. There will be signs throughout your building with the name of the C team members. These are the ones who will be called to the scene in the event of a medical emergency. Although we don't anticipate to having many medical emergencies, we always want to be prepared. I appreciate your time, and I'm looking forward to a great school year.